Hi, this is Jessica DaMassa at Health 2.0. I'm here with Michael. Michael, please introduce yourself.
I'm Michael Singer. I'm VP of Technology for Veyo Logistics. At Veyo, we work with insurance companies, healthcare agencies, and we pick up their patients and drive them to healthcare appointments.
So this is a really interesting innovation that you guys have here. So
It
is, because there's not a lot of people who are innovating on that aspect of the patient experience. So tell us a little bit more about what exactly you're doing and how it's different.
Yeah, that's correct. So the niche we're in is something that not a lot of people know of, but Medicaid and Medicare Advantage plans provide transportation as part of their benefits packages in many, in actually every market that they're in. So today, the problem with this benefit is that the benefit isn't really managed in an efficient way, and there's many Americans, there's about 4 million Americans are the numbers we work with, that kind of miss doctor's appointments every year because they don't have adequate access to care. So what we're trying to do is kind of bring in all these huge improvements that happened in the consumer space with solutions like Uber and Lyft, and we're trying to bring them to the healthcare space.
Excellent.
But we're building an end-to-end solution that's focused on the healthcare logistics problems and not specifically to transportation, more kind of an overall solution.
Excellent. So really driving the consumerization of healthcare in a different way.
Correct.
So what kinds of trends are you seeing out there that within the health system as far as bringing a more personalized experience to the patient?
So our patients can book trips through member apps, but there's many members who don't own a smartphone or just want to talk to someone on the phone, and then we provide a call center for those kind of patients. There's patients who the doctor wants to book their trips, wants to manage their transportation. So we provide UIs, we provide APIs, we basically make it as easy as possible to create trips in the system.
Excellent.
And then we get those trips in, and we allow everyone who created those trips to manage them. We allow the plan to see what trips members are taking, and so on. We kind of make this a much more inclusive experience. So we try and make sure that every patient just gets access to their healthcare appointments.
Wonderful. And so what are you learning? What are some of the outcomes that are coming out of this?
So that's actually really interesting. We've seen a lot of studies around this, and one example that we like to use is when you look at the dialysis patient, they have to go to their healthcare appointment. They have to go 2 or 3 times a week. If they miss an appointment, many times they might end up in an ER. Obviously for the patient that's not fun, but also as far as cost, that's really expensive, right? So making sure that those patients have good access to care is critical. It's saving money. When we look at plans that work with us, we do a lot of predictive analytics and things like that. So we constantly drive fraud, waste, and abuse down.
Excellent.
But if we look at the metrics that everyone cares about, getting patients on time, patients just being happy with the service, they just keep going up. So
excellent. Well, thank you so much, Michael. We look forward to more innovations that are taking some of those lifestyle changes and providing those services in new ways to help deliver better care. Thank you so much for joining Health 2.0.